What are medical contact lenses? What makes them different, and why would you need them? In this episode of OCuTALK, Dr. Stephanie Wu will be explaining the difference between medical contact lenses and corrective contact lenses, the conditions that require these lenses, and how the fitting process works. Dr. Wu?
I want to talk to you.
Not now, later.
No, now.
Hello everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us from Contact Lens Institute of Nevada in Las Vegas, Nevada, Dr. Stephanie Wu. Dr. Wu, thank you so much for joining us today.
Thanks for having me.
Well, excellent. Well, we're so happy to have you here, Dr. Wu, and thank you so much for taking the time out of your day to chat with us. Before we get started, Dr. Wu, though, I was hoping that maybe you can introduce yourself to our audience. Tell us a little bit about your background and your specialty.
Sure. So my name is Dr. Stephanie Wu. I graduated from SCCO, and then I completed a cornea and contact lens residency in Missouri. And then I moved back to my hometown in Arizona, and I joined up with my childhood optometrist. And I was an employee there for a couple years and decided to buy into the practice. So I owned 3 private practices. And during my time there, there were no specialty lenses because my partner didn't want to do any of that stuff. So we were just doing regular eye exams, glasses, post-ops, medical eye exams. And then when I joined the practice, I told him I really want to do specialty lenses because it's my passion. I'm residency trained in it, and I think we can help a lot of people. So we were able to grow the specialty lens portion of the practice from essentially 0 patients to over 1,000 patients within a 5-year period. And then just kind of doing some reflecting on what would I love my career to look like, and what would be my ideal day. And for me, it was seeing specialty lenses. So 2 years ago, I decided to sell those practices and open up my Contact Lens Institute in Las Vegas. And now that's all I do. I only see specialty lens patients. I don't do primary care anymore. I don't have an optical. And so it's just a wonderful way to practice, and I'm really doing what I love.
Well, awesome. Very cool intro. Thank you for that, Dr. Wu. And for our discussion today, we were actually hoping that you can discuss medical contact lenses with us. What are medical contact lenses?
Yeah, so when you think of medically necessary contact lenses, the first thing that comes to mind is something is going on with that patient's eye that would prevent them from being able to use glasses or traditional soft lenses effectively. So they need something more specialized, like a custom type of lens, and to be able to see their best. So when I think of medical, I think, okay, this person is not going to be able to use traditional glasses and contacts. They really need something more specialized to be able to see their best.
Well, perfect. Thank you for explaining medical contact lenses to us, Dr. Wu. And so what are the differences between medical contact lenses and corrective contact lenses?
Yeah, so medical contact lenses are special types of contacts that are fit to the patient's eye. So traditional contact lens, those are kind of mass produced. So you're kind of picking a lens out of your fitting set and putting it onto the patient's eye. Whereas a medical type of lens, there's usually lots of different base curves and diameters and shapes and sizes to really able to kind of customize the lens to the patient's eye. A lot of times it's made out of a different material called a gas permeable material. So instead of being soft, it's a kind of a more rigid type of structure. And that provides a smooth optical surface and helps to correct for some of that irregular shape of that person's eyeball.
Well, excellent. Thank you for telling us the difference between those two contact lenses. And so we were actually hoping, can you discuss a little more about those medical contact lenses and the different types and what the conditions that they're used for?
Sure. So medical contact lenses there's a variety of different ones that are on the market. So we can start everybody's very familiar with soft contact lenses. So for mild patients that have a mild irregularities, you can actually prescribe something called a custom soft lens. So this is a lens that you would fit in the office that a lot of times it will have a fitting set, but it has a thicker center thickness to help mask some of the irregular astigmatism. So you can do that on some of these mild cases. Then there's also something called a hybrid lens. And that's where you have a gas permeable lens in the center, and then you've got a soft contact lens skirt. So essentially you're getting the vision of a gas permeable lens, the clear optics of that, but you're getting the comfort of a soft lens. We also have gas permeable corneal lenses. Anybody that's been to optometry school knows about these a ton because we learn a lot about them in school. But those are made out of a gas permeable material to help correct the surface of the eye, the irregular astigmatism, to provide very clear optics. And then lastly, we have scleral lenses, and those have become incredibly popular over the last decade. And those are still made out of the gas permeable lens material, but they're larger. So they sit on the white part of the eye and help to correct the irregularities.
Well, thank you for that information, Dr. Wu. We appreciate it. And Dr. Wu, are there warning signs that we should be on the lookout for to let us know, like, hey, we should probably be needing these medical contact lenses now?
Yeah, so that's a great question. Some of the red flags that you might see are if somebody has a prescription that is increasing dramatically every year. Also, if their astigmatism correction is very, very large or increasing dramatically year to year. Those are kind of the first things I would say, something like strange might be going on. You can also gauge it off of the patient's symptoms. So they may come in and say, hey, Dr. Wu, I feel like my vision isn't as good as it could be. I'm seeing some ghosting. I'm seeing some double vision. I have major problems with glare and things just look distorted. So a lot of times when I hear those kinds of things, then I think to myself, we really need to do a topography on the front surface of the eye and see if that's what's causing some of these issues. And a lot of times when patients come in with those problems, when we do a topography, we find out, oh, wow, they have some sort of eye disease. Most commonly for medically necessary contacts, keratoconus. That is a huge reason why patients would need these lenses. And that makes up about 75% of my current practice. So those are types of patients that you would think of, or really anybody that has some sort of irregularity on the corneal surface, such as maybe a corneal transplant. Maybe they've had LASIK or arcade surgery years ago, and now their vision is not as good as they had expected, or it's changed over time. Those are some of the top indications where I would start thinking of a medically necessary contact lens.
Well, perfect. Thank you for letting us know about the warning signs there, Dr. Wu. And so, Dr. Wu, what about the patients who have corrective lenses now? Like, is it common for your patients who have corrective lenses to make the switch over to medical contact lenses?
Yeah, so most patients that wear soft contact lenses or conventional lenses, and they're doing well, they probably don't need a medically necessary contact lens. But I will tell you that when we have a patient, and let's say they're wearing regular lenses, but they're still having these problems, they come in and they're wearing their contacts and they say, Dr. Wu, I'm still not seeing very well. My vision's kind of blurry, it's double. And then we do some testing, we say, ooh, this person really needs a medically necessary lens. Well, it's wonderful because once we show them in office kind of a diagnostic fitting and we show them what their vision potential is, they get really excited because they're able to see so much clearer and their quality of vision is so much better than what they're currently experiencing. So switching them into a medically necessary lens is quite easy because they're very motivated to see better.
Well, it's definitely good to hear. Again, thank you for that information, Dr. Wu. And Dr. Wu, we were hoping that maybe you can talk a little bit more about the fitting process for these custom contact lenses. What's that process like?
Yeah, so it really depends on what type of lens you are fitting. So if you're fitting a lens empirically, that means you're just using the data that you have and you simply order the lens from the laboratory and they ship it to you, and then you dispense or do a dispense or kind of fitting in the office. But traditionally for me, most of my patients have diseased eyes, so I need to do a diagnostic fitting in the office. So what's involved is they come in and we do a variety of imaging on their eye to kind of help us figure out what lens to select first. And then we will prepare the lens. So we'll take the lens out of the diagnostic set, clean it and condition it, and then we will put the lens on the patient's eye. Then I'm using some special equipment where I'm looking at the patient's eye and seeing what the lens relationship is like to their eyeball. And based off of what I see, I will either take the lens off, replace it with a new lens. Maybe the fit is too flat, or maybe it's way too steep. So we'll take the lens off and keep putting lenses on and off until we find something that matches the shape of their eye. So I think of it like fitting shoes. If you have no idea what shoe size, okay, well, let's just pull this shoe off the shelf and see how it fits your foot. Oh, it's way too small. Okay, put that shoe back. Now let's pick something bigger. Put that on. Oh, this shoe is way too big. Okay, well, now we have a bracket. So we know kind of it's not here and it's not here, but we know it's probably in this area. And then that kind of helps us figure out what lens is going to fit their eye the best. So after you find the best fitting lens, then you're going to perform an overrefraction, and that's going to tell you what prescription to put in the lens. And that tells the patient too, this is what your vision is going to be like when you get a custom lens. So they get very excited when they're able to see so well in the fitting. And then you simply just call the lab or email them, or whatever way you like to order your contact lenses, and simply order the lens, and then they will fabricate the lens and then ship it to you.
Well, perfect. Thank you for explaining the fitting process to us, Dr. Wu. And I love the shoe analogy, by the way. That was very nice. Dr. Wu, what about the care process? Like, is it the same as corrective lenses when we clean those lenses? What is that typically like?
It's similar. So anybody that's worn contact lenses, I find that they are able to get through the care system and all of that process a bit easier because they're very familiar with having to clean and care for their lenses. So when you take the lens out at nighttime, you're still going to rub the lens just like you would with a soft lens, and you're going to rinse it. Then you're going to store it in a contact lens case. You're going to fill it with solution so that it gets disinfected overnight. So it's a very similar process compared to like a soft lens if somebody is using a monthly lens or multi-use lens. And then in the morning, they take the lens out, rinse it off, and apply whatever solutions they need to, and then place it in their eye. So the care process is similar to a soft lens, but we just have to make sure that we're using the right products, because if you're using a gas permeable lens or a scleral lens, those solutions are much different than a soft contact lens. So you want to make sure to educate your patient, or at least maybe give them a sample of the product that you want them using, because gas permeable lenses are cleaned a bit differently and they have different chemicals that they use to clean those lenses properly. So the process itself is very similar, but the products that you're using are a little bit different.
Well, thank you for explaining the care process to us, Dr. Wu. And so I know that with regular contact lenses, corrective lenses, that they need to be replaced sometimes. Is it the same for these medical contact lenses? How often should they be replaced?
This is a great question, and this is one that I get every single day from my patients. So it depends on what type of lens we fit them in. Sometimes we'll fit them into a custom soft lens, and those lenses usually need to be replaced every quarter. So every 3 months, they need to throw that lens away and open up a fresh vial and then use that new lens to help prevent infections. A hybrid lens, those are usually just replaced every 6 months. So they can use the same lens over and over again for 6 months, and then they would throw that away, open up a new one. With a gas permeable lens or a scleral lens, I always tell patients you're probably going to get 1 to 3 years out of this lens. And it depends on a variety of things. If your prescription changes or the shape of your eye changes, you're probably going to have to replace the lenses more frequently. If you have a more stable eye condition, you might fall in the longer kind of range. And it also depends on how well you take care of them. So if you are rubbing the lens really hard, if you get lots of things in your eye like dust and dirt, and that is scratching the surface, if you have an ocular surface that produces a lot of mucus, lipids, deposits, things like that, that might break down the material a bit faster. And so on that kind of spectrum, those people are going to maybe not be able to get the longer lifespan out of it. So always tell patients, this is kind of the range. I have no idea where you're going to kind of fall, but we will check you, every 6 months to double check and see how the eye is doing and how your prescription's doing and what the surface of the lenses and quality of the lenses look like. And then we can make some recommendations on if you need to replace them or if you're okay to keep going with the same ones.
Well, great information, Dr. Wu. Thank you so much for that. And what type of cases do you see the most in your office?
Mostly my patients are keratoconus patients. So that makes up about 75% of my clinic. But I also have lots of patients that have eye diseases such as corneal transplants. They've got corneal scarring, corneal dystrophies, things that make their eyes very sick and unhealthy. Those are the types of patients that we see the most. We also have a healthy section of our office for specialty lenses with something called orthokeratology. So those are lenses that are used for mostly young kids to help prevent their myopia from progressing as quickly. So those are like a totally another type of specialty lens, not medically necessary per se, but still a specialty type of lens that we see in our office.
Well, excellent. Thank you, Dr. Wu. And I know we talked a lot about today about different, contact lenses and different cases that you see. I wanted to know, though, are there any cases that you see where contact lenses wouldn't be recommended at all?
Yeah, so sometimes patients have very diseased eyes and their eye is just not going to tolerate a contact lens very well. Another thing is sometimes I see patients that have corneal transplants and their endothelium is not functioning at a high level. In those cases, sometimes it can be very challenging to fit those people into contact lenses. And then patients that are monocular, so they only have one good eye, you have to be very careful with those types of patients and weigh out the risks and benefits, because if you only have one good eye, as we know with all the research, anybody that wears contact lenses is going to be at a higher risk of developing an eye infection compared to somebody that doesn't wear a contact lens. So like a case report example would be a patient that I have that he only has one eye, but he also has very severe keratoconus. So for him, glasses are just not an option. He cannot see anything. So we have to fit him into a specialty contact lens, but we just have to make sure we monitor him very carefully and that he is very well educated on the risks of contact lens use and the risks of developing infections. And we just need to make sure that he's caring for his lens very, very well. Because if he has an infection, he could go blind. So it's just really kind of weighing out the risks and benefits of each patient's specific case.
Well, perfect. Again, thank you for that information, Dr. Wu. And are there any new technologies or new developments that are on the horizon right now with the medical contact lenses that we should be on the lookout for?
Yeah, so something so exciting is where we can actually map the white part of the eye called the sclera, and we are able to design these very, very custom lenses based off of the shape of the scleral topography. So that has given us the ability to fit these lenses at an incredibly high level with incredible amounts of customization. So I definitely think, right now, it's not as many doctors that are doing that because the equipment costs a lot or the software, is a bit expensive, especially if you're not fitting a lot of specialty lenses in your office. But as I think the technology improves and becomes more affordable, I think if I had to predict, that will just become the gold standard of fitting lenses, is checking the shape of the cornea, checking the shape of the sclera, and then designing a lens custom to that person's eye.
Well, we'll definitely be on the lookout for those new technologies. Dr. Wu, thank you so much. And before we leave today, was there anything else that you'd like to tell our audience?
Well, I always get questions on how to successfully fit these lenses. And I always tell people that fitting specialty lenses is very rewarding. You change a lot of lives, and there's a lot of resources to help people succeed. So there's two nonprofit organizations. One is called the Scleral Lens Society, and the other one is called the Gas Permeable Lens Institute. Those are two nonprofit organizations that are committed to helping practitioners fit specialty contact lenses. And so I absolutely would recommend people checking them out and they've got tons of free resources, papers, articles, webinars, just archived journals and webinars and things. So those companies are fabulous and really, really help. And then at some of the major meetings, such as Academy, AOA, GSLS, I mean, these are meetings that have workshops where you can learn how to fit specialty contacts. So if it's something that you want to do, there are plenty of resources and ways to learn how to fit these lenses. You can always reach out to me. I absolutely can help facilitate some suggestions if it's something that you're really interested in. But it is so rewarding. We've changed so many lives with these lenses, and I highly encourage practitioners to look into it because there are tons of free resources to help you succeed.
Well, fantastic information. Thank you for that, Dr. Wu. Everyone, that's Dr. Stephanie Wu from the Contact Lens Institute of Nevada in Las Vegas, Nevada. Dr. Wu, thank you so much for joining us today.
Thanks for having me.
Thank you all so much for watching this video. And thank you so much for watching all of our OCuTALK videos in 2021. It's been a fantastic year getting to learn about all these different doctors and these different practices. From all of us here at OcuSoft, we wish you a happy holiday season and also a happy new year. We'll see you in 2022.